concierge medicine, is that really a good choice for me to choose for a healthcare provider? I want to go through and talk about this from the standpoint of a pharmacist that works with concierge providers, medical doctors, but also from Rx Healthy Habits standpoint, because I believe when it comes to your health, if you really value it like I do, there's sometimes you have to invest in it. And we're going to go through and talk about why a concierge medical provider might be right for you. Now, number one, people say, what is it? What is it? I mean, heard the term, but what is it? Well, concierge medicine is also known as boutique or retainer medicine. That's where you pay a fee, a membership fee, above and beyond, when they bill your insurance for the visits. There's a fee you pay annually or monthly or quarterly that's above and beyond to retain that provider for enhanced services and comprehensive care. So it's a notch above the care you're going to get because you're paying a membership fee to see that doctor. And that's pretty phenomenal when you think about it, because now he or she is getting a fee just to take you on as a patient. Now, what does that do? Here's some key features. Number one, personalized care. The care that you get with a concierge provider is much higher because they don't have the thousands of patients they see. They usually see under 500 patients a year, where a primary care doctor might be seeing 3,000 or 4,000 patients a year throughout the whole year. So think about that. There's some offices that see 3,000 or 4,000, their offices see 500, 600, sometimes lower. So think about the personalized care. Direct access. This is the biggie, I think, one of the biggies. 24/7 access to the provider. When you have a concierge provider that you pay for, you're going to have 24/7 access by phone, by text, by whatever you set up. It's going to really reduce your emergency room and your urgent care visits. Extended appointments. This is a big one. You're not going in for your typical 10 minutes with a provider, maybe, after they do your intake and they do your blood pressure. The time that you get with the average provider normally, and I'm not putting them down for primary care, family medicine, not at all. They're busy, they're seeing a lot of patients. But typically, with a concierge provider, you're going to spend 30 minutes, sometimes 45, with that provider, really digging in on how he or she can help you. Huge. Here's another big one, preventative care. They really pride themselves on the fact that they're going to try to keep you out of the weeds. So if they see some things on the horizon with some of your blood work and some of your labs and maybe your physical exam, some of your patient histories, they're going to say, hey, look, we have to do some things. And it really is a big emphasis on regular checkups, really in-depth, comprehensive physical checkups, and a lot of other services there when it comes to preventative care. Wellness services, a lot of coaching on fitness, dietary, weight management, stress management. They're really big on wellness services, which I think is key. And of course, at Rx Healthy Habits, it fits right on what we do, right? We're all about that. That's our main focus, is really fitness and nutrition, diet, trying to get to normal weight. They do a lot with weight management, which I think is the center point of any preventative care. Why are more patients choosing this type of medicine, concierge medicine? Well, quality of care, beyond a doubt. That's probably the biggest thing. The enhanced quality of care does surpass what you're probably going to get with a normal primary care or family practice clinical setting. Now, there's exceptions, but typically they're seeing far too many patients because their volume has to be that way because of their reimbursement. Remember, these docs are paid every patient anywhere from $150 to $250 a month membership to retain that provider. So a concierge has this money coming in, so it takes a financial burden off them to have to see so many patients just to make any money at all, because they got to pay their office staff, they got a lot of overhead. So enhanced quality of care. Convenience, 24/7 again. The convenience, though, of not having to go through a whole bunch of layers to get to the provider. The convenience of just picking up the phone and you got your doctor on the phone. Think about that. That's crazy, right? Reduce wait times. This is a big one. Now, I was really frustrated when I go to see a lot of providers how much time I wait in the waiting room. And, everybody say, well, they're busy and important. Well, guess what? So am I. And I don't think I should wait as long as I wait. And then when I get in there, wham, bam, it's done in like 7 to 10 minutes, maybe, on a good day. And I always feel like, is that it? I waited all this time and you told me something that I could find on the internet? You didn't talk anything about preventative. You didn't talk anything about what am I doing to maintain my health? How I can maybe find out if there's some things down the road that I should be looking at my age. Nothing. Very little. It's not the way it should be. So the reduced wait times, that was big for me. The preventative focus we talked about, they're going to really try to make sure that if there's anything on the horizon that could possibly get you in the weeds, they're going to find out what they can do to prevent that. And that might be running some tests, some screenings, all kinds of things. So you got to really pay attention to that. But their focus is preventative. And the last thing is the patient-doctor relationships are so strong with the concierge provider because you got that communication with them anytime you need it, but when you go there, you're going to spend time with them. So time really does help develop relationships. And most of the patients I talk to, they love their concierge provider, and goes the other way too. Very rewarding for the provider, and a lot of providers are choosing it because they'd rather have a quality of life and actually be a provider of services that they went to school for. So I hope that makes sense. Here's some barriers. Now, the big one that comes up all the time is cost, and some people consider that to be relatively expensive to pay $150 to $250 a month for this service. And that's a big thing for some people. You got to weigh that. You got to ask yourself, what do you spend, let's say, $10 a day on now or $7 a day on now? And you have to equate that. Do you want to spend that to have a healthcare provider that's going to be there for you when you need it? I don't know. That's your call, right? You got to figure that out. I think it's a good value because having that type of availability of a provider, especially if you have some disease states, or if you're trying to dial in your health and get healthier, really key. But cost, let's not ignore it. It's the elephant in the room for a lot of people. Here's what some people say: well, you're going to have limited insurance coverage for a lot of these services. Yes. Sometimes they don't pay for concierge services. That's why you pay the upfront fee. Your insurance is still going to be billed for the office visit. That's no biggie. So you're really not going to be able to say, okay, I'm going to have all my concierge services paid for by insurance. Probably not going to happen. But your office visits are. Here's one. This is one that some people say is a downside to concierge. Reduce access for non-members. If you're a non-member, you can't make an appointment with that doctor. And they say, well, that's kind of restrictive, and what about some underserved areas? Well, I'll tell you what, there's other options out there, but if these guys are paying to have a membership, it's kind of like if there's a country club and they're paying $3,000 for the country club, non-members can't go and just walk in and enjoy the country club, right? Without, they just can't do it. So reduce access. That's some people say, well, that's really not good. You don't have access. And then the potential for unequal access across the healthcare field. So what they're saying is, this is going to make healthcare inequities even worse where people can't get healthcare. I don't believe that. I believe there's a segment of people that are going to go to concierge medicine. It's not going to be a huge segment. It's going to be substantial, but it's not going to be everybody. So therefore, there's plenty of services out there. And maybe it's also going to be a wake-up call for some of these healthcare facilities that do a really poor job of customer service. I'm sorry, some of them do, some of them don't. But a lot of them, it's like there's no competition. Well, now there's starting to be a little bit for some of that. So hope that helps. But I got to give you an overall view. My wife and I, we're in the Las Vegas, Henderson Valley area, and we deal right now with about 10 concierge providers that we provide pharmacy services to the independent pharmacy we work for. And I got to tell you, overall, if I was to say from a pharmacist standpoint, for patient care, for doctor-provider relationships, access, I'm going to say that concierge is a really good fit for most people. It'd be a good choice. And as Rx Healthy Habits, the founder and owner of that and creating content, I got to tell you, they're right in line with what we're doing, which is preventative care and wellness. And I think sometimes other provider services out there don't really focus as much as they should on those two things, and they don't give the counseling and the wellness, and they don't do some of those things that you're going to find a lot more with a concierge provider. So my opinion, Rx Healthy Habits, and again, my opinion, my wife and I, Elizabeth, I think it's a win-win for everybody. So if you got a loved one, maybe, and if you want to gift them a concierge medical provider, I think they're going to love it. So until next video podcast, Joe from Rx Healthy, stay strong, stay healthy, and find yourself a healthcare provider like a concierge medical provider that you really like, that you can dial in your health with. So stay healthy.